Catheter extravasation. When the catheter leaves the body, that's when there's medication going into the subcutaneous tissue. We're going to discuss that. What about blood reflux? Did you know that blood is going into your catheter without you even seeing it? We're going to show you that as well. All right, so what's the solution? Laminar for PIV, gentle. Pulsatile for CVCs. Those two are my opinion based on what I'm going to show you, the science behind it. Adequate vein purchase. You need enough catheter in the vein. If you don't have enough, it's going to come out. I want you to do this. Take your arm, and I want you to move, right here, move your skin. How many centimeters are you moving? 1? I'm moving 2, maybe 3. What about our elderly patients who have very loose skin? They move 5 centimeters, they move 10, no, 10's a lot. There's a lot, they move a lot. So if your catheter is only 2 centimeters and their skin moves 7, is that enough? That's why they're coming out. You can glue it, you can staple it, you can melt it onto the skin, but the skin is gonna pull it out of the vein. So we need a long enough catheter to sustain that. Here's another thing, clamping sequence. Do you guys know do you guys have the extension tubing with the IV, and then sometimes? So there's clamping there. Does anybody know when you're supposed to clamp it? When?
Before flushing, in between syringes, after unclamp before final flushing.
Yes, okay. So after the final, it's okay, you're doing very good. After the final flush, do we clamp it and then remove, or do we remove and then clamp it?
Clamp and then remove.
Clamp and remove, for which one? In Latvia, there's 2 main types of needleless connectors. One's positive displacement, I've seen it, they sell it here, and one that does negative. The negative, you need to clamp and then remove, but the positive, you have to remove and then clamp. Or else it doesn't work properly and things will go inside that catheter. All right, so we're gonna talk about that. So high pressure. Who knows who Virchow's triad is? Who's Virchow? Yes, yes. Virchow discovered that there are 3 main reasons why we clot, why we thrombose. When blood's supposed to move fast, but when blood moves slowly, it starts to clot. Atrial fibrillation. What medication do they get? Heparin or Coumadin, warfarin, right? Anticoags. And if it stops, it's definitely going to clot. Endothelial injury, trauma to the vein, and also hypercoagulability, which is disease. All right, let's talk about endothelial injury. Please say yes. Did you know that there's blood in the vein?
Yes.
No, you didn't know that? Awesome, you're going to learn a lot today. Did you know that the vein has cells? It's called endothelium. Do you guys call it endothelial? Yes. Endothelium? Yes. Did you know that there's something in between? It's called glycocalyx protein. Glycocalyx is a gel-like substance that's inside of the vein. It protects the vein from the blood. Why does the vein need protection from the blood? Have you heard of clotting factors? Factor 1, factor 2, factor 3. If they touch the walls, they start to create clots. If the inflammation markers start to touch the walls, they'll start to create inflammation. So there's things in the blood that's not good for the veins, and the glycocalyx protein protects the veins, the cells, from these proteins. So this is the definition. Don't worry. I'm not expecting you to read all that. Is that a knife? Yes, that's the reaction I'm looking for. Is that a knife? No. What is that?
Pressure.
And water. There's water in this cup. I promise you it's not vodka. Did this cut my mouth?
No.
No.